Hello, I'm Dr. Kerstin Kelly of the Ontario Party. I was the daughter of Anne and Armin Maynard, who were poor immigrants who escaped from East Germany and moved to a subsistence farm south of Bobcaygeon. We came to the land of freedom and opportunity. I went to Bobcaygeon Public School, Fenland High School, and eventually to the University of Guelph. While in Bobcaygeon, I was involved in every kind of sports: Bobcaygeon 4-H, Bobcaygeon Horse Force, Bobcaygeon Agricultural Society, and the Fair Board. I even earned a place on the Canadian Junior International Equestrian Team, and I rode for Canada in Mexico, Cuba, and multiple times here at home. All the while, I was working 2 jobs every summer, including researching the book for Educating Victoria County for the Trillium Lakeland School Board, working the locks on the Trent Severn Waterway in Bobcaygeon, Lindsay, and Buckhorn, doing an inventory of the Ken Reid Conservation Area, and water sampling throughout the Kawarthas for the Kawartha Region Conservation Authority, as well as tree planting. I was always sanding and taping cars for my dad, haying and doing farm work for various farmers, Lloyd Wicks, Morris Taylor, painting fences for Case Manor and numerous other people and barns, as well as being a veterinary assistant at the Lindsay Animal Clinic and Kawartha Veterinary Services. I put myself through university, graduating with an honors Bachelor of Science in Zoology. I studied biostatistics, how to lie with statistics, epidemiology, immunology, nutrition, ecology, and virology. My university career unfortunately was lengthened by a major car accident when I broke my back, my hip, my femur, folded my foot in half, broke my ankle in numerous places. I've had multiple orthopedic surgeries, pins, plates, KE wires, was in traction, spent time in ICU, physiotherapy, rehab over a number of years, so I know the hospital system inside and out. During my university, I passed my private pilot's license to fly my own aircraft, a passion I had since childhood. And that brought me to learn about small business in the School of Hard Knocks. I purchased a share in Lindsay Air Park Limited in 1986 for $2,000, and then learned I had an extra $50,000 in debt. I married my partner and best friend, Neil Kelly, in 1988. Our family operated Lindsay Air Park, Lindsay Aircraft Maintenance, Lindsay Aircraft Charter, and Linvic Flying Club with 3 training bases in Lindsay, Barrie, and Orillia, until amalgamation and 9/11 in 2001. I know there's a lot of money in aviation, as we put it there. Every year you would think this is the year we could finally turn a decent profit, and every year the government came along with another program to erase that possibility. Government overregulation is a huge deterrent to small business in our area. And there's a huge difference between making 10% and losing 10% when you're turning millions of dollars. We also bought Crooked Lake Wilderness Lodge in Norland and operated it as a corporate retreat, ecotourism escape, until COVID started. And it's been shuttered ever since. Simultaneously, I practiced veterinary medicine in Sutton, Beaverton, and then after our first child was born, practiced in Peterborough until I was able to get my first clinic established in Bobcaygeon in 1992 when my second child, Lauren, was born. So having our own daycare for Lauren and Alexandra was a blessing. I expanded to the Fenland Animal Clinic in 1995 and Victoria Veterinary Services in 2005, employing well over 20 staff members at one time. I retired veterinary emeritus in February 2020. I was enjoying spending time on the farm in Oakwood with my family, dogs and cat, tending to the garden, chickens and horses, and traveling in my own aerobatic Citabria airplane. On warm sunny days, I was even out on my motorcycle, touring and exploring the roads of Haliburton with the Sky Dogs and my husband of 34 years and our eldest daughter. Devastatingly, our family lost our youngest daughter to suicide in suspicious circumstances in Sault Ste. Marie in 2013. Having been a long-time Toastmaster and trained in leadership and communications, it led me to become assist trained which is the Applied Suicide Intervention Training Program. I was trained to teach assist and Safe Talk, which is also to keep people safe in suicide circumstances. I've put on a number of suicide awareness and prevention seminars in the area. Last fall, during the crisis in Ontario, I joined the Woodville Freedom Group of Rise Up Kawartha and did several presentations on self-care, emotional first aid, suicide awareness prevention, and brought in several speakers on self-reliance and preparedness. We grew this group to well over 700 members, and we now have homeschooling, gardening, farming, nutrition, finance, and communication groups, as well as promoting respect, responsibility, human rights, and freedoms. We support freedom, family, and faith. I care about people deeply, and my history and experience have taken me into business, economics, healthcare, education, and politics. Everything in my life has led me to this moment where I stand before you as your candidate, your representative, and your strong voice for a change. Just to update you about a few local happenings, I had said Laurie Scott had never done much in Queen's Park for Halliburton, Kawartha Lakes, Brock. Well, Laura on our team found a bill that she was ramming through without public knowledge. Bill 65 concerning the Ross Memorial Hospital. And just a bit of background on that. The Ross Memorial Hospital was incorporated by a special act in 1903 when John Ross donated the money for a hospital and set it up so it couldn't be easily destroyed. And significant changes to the structure of the board, governance, and operation had to be run through the legislature. And acts enacted in 1954, 1964, and 2000 also affected the operation of that act. Unlike the 1954, 64, and 2000 amendments, this section of the act that Laurie put through Parliament in March for the first reading was a total repeal of the 1903 Act and subsequent amendments. The plan, therefore, is to entirely erase the historic legislation that created our hospital, not to amend it, but to entirely repeal it. It had been tried already a few times when Laurie had got Gila Marteau of Richmond Hill to try and stop the process, but Gila Marteau had to back off due to the Health Coalition pressure. And then Laurie got Christine Hogarth to put it forward, and it failed. Amalgamation with the PCRH has been tried and failed. Now, the Kawartha Lakes Health Coalition and the Ontario Health Coalition engaged with the interim CEO on the board on multiple occasions requesting changes to the proposed bill. All of these had failed in the past, but this time Laurie, without any public consultation, rammed it through first and second readings without letting the public know. The act eliminated community memberships. Over 700 community memberships were wiped out, and in effect made it a self-appointing board. And by changing the words "and" to "or," and changing the words active treatment, changing the words acute inpatient care to active treatment, it in effect removes the requirement of the Ross Memorial to be a hospital. It removes the requirement for emergency services, surgeons, surgeries, acute medical care, medical beds, diagnostics, and ICU. The facility may just become a place for chronic long-term beds and private clinics. John Ross's donation to the community will be gone, erased from legal history. How did we get so far down the road that now, this week in Geneva, at the World Health Assembly of the United Nations, controlled by the Chinese Communist Party, Trudeau is on the brink of signing something that's going to affect the sovereignty of Canada. By May 2020, 1,377 people died in Ontario long-term care homes. Ford promised to fix the long-term care homes. He said, "I'm going to fix the system, no matter what it takes." He didn't. What Ford did is he let 3,000 more residents die. There's no fine system, there was no penalties. Natalie Mera attested that people were starving to death. At that point, everything should have been done. Residents in their beds, isolated, scared and alone, dying among strangers. There's never been a charge against a home. Even after the military investigated the homes and the long-term care and found that people had died not of COVID, but of dehydration, starvation, and lack of care, Ford did nothing. Instead, he passed Bill 218, which prevented families from investigating and charging homes themselves. Did you know that we had an emergency management organization in place for pandemic situations and not one life needed to be lost? Strategic plans that could have saved every senior who was at highest risk. Ivermectin, hydroxychloroquine could have saved every patient that wasn't already dying of something else, just like it did at the home that had the scabies outbreak in Toronto. Every patient was treated with ivermectin, and none got COVID, even though the staff did. It's time to vote for the Ontario Party, which cares about people and has a recall policy that people can fire any of their representatives who don't perform in the best interest of the people. We must fire Ford and Laurie Scott and Dave Smith now. This is the most important election of our lifetime. Vote for a change. Together we can win. We must win. I need to know at the end of the day that I did everything possible to make a change peacefully as the world is going down a very dark path. We need hope. We need love and compassion for a better world and for ourselves and for our children and grandchildren. Vote for a change. Vote for your Ontario Party candidate. Vote for me, Dr. Kerstin Kelly.